Congratulations on getting into medical school.
Thank you. And
Congratulations to you
in a
too.
lot of ways, like as you get older, you begin to understand, especially from a Christian perspective. Sometimes you're not always gonna have those, like we said before, answers to the questions. Growing up, I always knew I wanted to be a doctor, but my life is mine, but my life also belongs to God, and my goal every day is to walk in His purpose. So I can say that if this is what God wants for me, then He's going to continue to open those doors and give me the strength to do well in the test, give me the strength, and as long as I have faith, to do well in everything that comes my way.
This is The Scene in S.T.E.A.M with Jade Frederick.
Ethan,
Hello.
welcome back to The Scene in S.T.E.A.M.
It's good to be back. It's been too long, honestly. It feels like yesterday.
I know. It's been like 3.5 years.
Yeah, wow, I remember I told you, it feels like yesterday, but then again, it feels so long. I don't know.
Yeah.
But it's good to be back. Really good to be here.
No, med school is crazy. The hours steady are long, but the years and the months are so short. Yeah. What's new? Anything?
Well, honestly, since the last time we spoke, I started medicine, and with you, obviously. And it's just been a journey, And now I'm here doing a gap year, getting my master's, and kind of seeing where God leads me from there. But honestly, other than that, nothing's new. I feel like I'm just trying to figure out life a little bit more and figure out my purpose.
Yeah.
And where God wants to lead me in medicine. So.
Awesome. I mean, your last episode, we definitely talked about intersection of science and religion and, your path, God leading you into medical school. And now you're here after, studying the human body and studying all these intricate processes and going through the trials and tribulations that is medical school. How have your views changed, if at all?
I mean, it's definitely shown me that God is real. I would say it's been interesting just being able to understand how the body works from a different perspective, not just science or atom-based. It's, I've been able to even see it in action, being in the hospital and seeing diagnoses that you would think couldn't be cured, and then you end up praying or seeing God work in that person's life, and it changes, it really changes your perspective, and it reminds you that, not even science can explain the work of God. So, honestly, I would say, I think my view before even still stands, that God really is the ultimate, only creator. And He really took His time with us. Honestly, you could see in just the way that we are as people and the way that we were designed. So it's even kind of hard to say now. I just know that being on this journey has even redefined, actually more not redefined, but solidified my whole view as far as believing that He is the ultimate creator. So it's been a really beautiful journey for me so far.
And is that just, your experiences in clinical or the preclinical years? Have you kind of seen them working in your life then too?
Yeah, so preclinical years, I feel like I was really focused on what is the atomic number of, hydrogen, and trying to really focus on things like that. Of course, you can see from the smaller angle, the way God really designed all this, and He's like an artist, right?
Yeah. But
then being in the clinical years, you get to see why we do the things that we do, or how the things from the smaller perspective really add up to allow us to do the things that we do from the bigger perspective. I would say my views are still pretty much the same. It's just, once again, just seeing Him work and seeing how special we are and how fragile we are as well. It's just been interesting, honestly.
Yeah, it's really interesting because as you're learning all these intricate processes inside your body. You're like, wow, God, you really did all that. That's insane. And then once you're in clinical and you're dealing with people, you kind of see God working on you on the outside and everyone else, and our interactions with people. So I agree. And I mean, we attend a faith-based institution, so I feel like it's very normal for us to discuss this, and we discuss this with our professors, which I feel like is a blessing. But how do you think personally it's affected your approach to patient care and just dealing with patients that are, you know, in really difficult situations?
That's a very good question. Honestly, I think one thing that I really enjoyed about being at Loma Linda is it's given me the chance to combine my faith as well as the love that I have for medicine and helping people. And just even working at the hospital and seeing people go through things that you couldn't imagine going through, or seeing a loved one go through. It just reminds you that, man, this is bigger than us. And sometimes when medicine can't solve the answer or solve the problem or give you the answer to the question that you need, prayer is the only thing. And I've seen that where we prayed, or I've seen attendings, you know, at Loma Linda pray and add that to part of the plan that you have for our patients. You know, they say, hey, how's your spiritual walk? You know, what do you believe? Do you mind if I pray with you? They don't force themselves on anybody. They ask someone, how do you feel? And they add that to the plan. And you just see how much more lively patients get from being able to have that as an option. And I've even seen, you know, a patient come back and say, wow, you know, I feel so much better, or I feel like things are working out. Of course, it could be in the mind. You know, we know the saying, if you give a patient, or the test that they once did, they gave patients sugar water and other patients actual medicine, and the patients with sugar water that were told it was medicine, they're like, oh man, I feel better. You know, it's possible, but I do believe that God works in mysterious ways. So it's been really interesting being able to be at an institution, work at a hospital, see attendings, add that to their everyday ministry, and just see how it touches patients in many ways. And I would even be more interested to see how it still has impacted them later on to even this day. So I think it also just reminds us that we can find everlasting life through Him. So yeah, I will say I've really enjoyed that aspect of being here and seeing that faith practiced on a day-to-day basis.
And I feel like we're very blessed because we almost get trained on how to pray for patients, for lack of a better word. And I feel like a lot of medical students, you know, not at faith-based institutions, you know, they're kind of up to their own devices with things like that. But I guess for students who haven't had that training or don't feel open enough to discuss it, what's kind of your advice or your approach to, you know, praying for patients or bringing faith into, you know, a medical situation?
Yeah, that's a good question. I mean, honestly, I think I gotta tell a short story. We've all had this experience. I think it was second year, or maybe it was third year, where we would go to clinical skills and have a fake patient. And instead of doing the normal approach where we go talk to them, ask them what's going on, you know, do the old carts, it was very much, I think it was a spiritual one where we went to ask them how their spiritual health was and pray with them. I don't know why I felt more nervous doing that than your typical OSCE, going in and just trying to figure out the problem. Because you feel like you're overstepping, you know, or you feel like maybe I shouldn't ask this patient about their religion, or maybe if I do, I might touch a nerve, or I'm really supposed to be here, you know, with the hat of a doctor, not the hat of a counselor or anything else. But that's actually part of what being a doctor is. It's doing so many things. We don't go in there just to fix the diagnosis. We go in there to help the person and allow God to use us to fix. So I think when you kind of change your approach and think more about how you want to help the person and not just the disease, it makes going in and talking to patients and asking about spiritual health and even praying with them that much easier. And when you also just get used to asking the question, you know, are you okay if I pray with you? Or how do you feel? I think sometimes that's better than saying, you know, what faith are you? If they don't feel comfortable, then they'll say, yeah, I don't feel comfortable, and that's okay. But if they do, they'll say, yes, go ahead, please do. And I think really all I'm saying is just ask. Just ask to, you know, ask, and if they're comfortable, it's okay. Yeah. It's kind of like how we're also told, you know, you have to ask patients if they smoke. I remember before when we first started, I'm like, yeah, I don't know, want to ask a patient if they smoke. I don't want to ask a patient what their preference is, because, you know, it might be uncomfortable for them. Yeah. But that's the thing. Once you work through the discomfort, you become more comfortable. And it becomes that much more beautiful. Yeah.
Yeah, I agree. Like, you have to just ask and just be curious about them in general. I feel like sometimes medical students are like, no, I don't want to prioritize, but that's really what we're here for. And, you know, at Loma Linda, we really emphasize like whole person care. And, like, patients will tell you things they won't tell, like, their best friend, they won't tell their mom. Yeah. So, yeah, I think it's like we're in a really privileged position in that we have a lot of trust, but, you know, with great power comes great responsibility and whatnot.
It's true.
So, it's important that, like, we meet them where you are, like you said, and not like, what is your religion? What, like, you know, all these questions, but just like, what can I do for you? You know?
Yeah, just asking the question, and, you know, once you ask that question, you break that barrier, it gets better. Yeah, it gets better over time. I remember praying with my first patient, and I felt so good afterwards, and they felt good, and it felt like a wholesome experience. And it felt like something that I should have been doing a long time ago. And after I did it the first time, it just became that much easier. Yeah. So it became a part of my ministry. So it's something that I plan to hopefully carry with me when I become an attending.
Absolutely.
So.
Yeah, well, and thank you so much for your insight. I hope, you know, the second round of interviews for you was as good as the first. How do you like the new setup?
Wow, I mean, you know, honestly, it looks amazing, as it always does, you know? Yeah, wow.
Pretty cozy.
Yeah, and I really think, like, continue doing this. It's a ministry of your own as well, just bringing people together and giving them a chance to share their own experience. So, yeah, honestly, it doesn't, no matter what the spot is, as long as you come with the vibes and the good questions, I think that's all that matters.
For sure. Only then I know you're going to go and do great things, but thank you so much for coming today.
Thank you so much.
Yeah. Thank you so much for tuning into this episode of The Scene in STEAM. I'm Jade. If you'd like to help out students studying science, technology, engineering, art, and math, please check out the links below. And I hope you can join us for the next episode.